Hello, everyone. I am Prokar Dasgupta. I am the King's Health Partners Professor of Surgery, and it's my great pleasure to have with us today the Right Honorable Professor the Lord Ajay Kakkar, Chair of King's Health Partners. Welcome, Ajay, and congratulations on the KBE at the Queen's New Year's Honours. Tell us, how did you celebrate?
Well, thank you very much indeed, Prokar. Actually, I was very privileged and very honoured to receive it. But as is so often the case in life, the moment always passes. But it was with family, and it was reflecting on actually what a lucky person I am and what a marvellous career I've had, all of which started at King's.
Indeed. And let me ask you about that marvelous career and start with your career journey with the hope of inspiring other budding clinical academics and surgeons. So I know that your father, Ajay, was a prominent vascular surgeon, wasn't he?
He was indeed. My late father was Professor of Surgical Sciences at King's College Hospital Medical School, which became King's College School of Medicine and Dentistry, part of KCL eventually. And he came to King's actually in 1965 as a research fellow and started his interest in thrombosis, and then was appointed consultant surgeon at KCH and ultimately Professor of Surgical Sciences. I actually, Prokar, had always wanted your job, because when I came to medical school, the thing I wanted to be was Professor of Surgery at King's, but I never made that. You got that job. But I had always wanted to be a surgeon from the time I came to medical school. And actually, inspired by so many remarkable teachers and mentors at King's, I decided I would also like to pursue an academic career, and that's what I did.
Wonderful. You mentioned that you started your education at King's College London, of course, but your research interests include the prevention and treatment of venous and arterial thromboembolic disease and cancer-associated thrombosis. So tell us a bit more why thrombosis, a very, very hot topic with NICE guidance and other guidelines, of course, but why thrombosis, and perhaps one discovery that you are most proud of in your career?
Well, why thrombosis? It's an important problem, and it was fascinating. Probably for me, it was an inherited disorder, an inherited defect, because my father had a substantial thrombosis interest, and I became interested in that. His was really in venous thrombosis, its prevention and treatment, particularly perioperative thromboprophylaxis to prevent fatal pulmonary embolism. And when I was at the Hammersmith as an SHO, I became quite interested in the question of cancer-associated thrombosis, and I did my own PhD in that area, and subsequently went on to be involved and was able to collaborate with some remarkable people around the world, and hopefully make some useful contributions in that area. But also, over the last 10 to 15 years, I've become quite interested in the development of new anticoagulants, the factor Xa inhibitors, and indeed more recently in the burden of thromboembolic stroke in patients with atrial fibrillation. So I've moved around a bit, but always around the theme of intravascular thrombosis.
Fantastic. Now tell me, with so much academic and surgical work, how did you hold these amazing other roles in public service, including the House of Lords, of course, the Privy Council, the Judicial Appointments Commission, the King's Fund? How do you take your interest from academic surgery into politics?
Well, I've always felt that it's important for each of us to try and make a contribution to the organizations in which we work, the communities in which we participate. And so all the way along, I've tried to help out. And eventually that took me in the direction of the House of Lords, where I was appointed in 2010. And on getting there, of course, it's a fascinating place. One's at the heart of the political system, and one is also at the heart, rightly, in a chamber and a political chamber of the legislative system. And I've been fascinated by all of that since school days, actually. I did something at that thing, I think it was called an AO level in British Constitution, Government and Politics while I was at school. And that gave me a great interest from that time in the Constitution and the way our government works and so on. And so really, people have been kind to me. They've given me remarkable opportunities to serve. And in each of those organisations, I've been able to work with remarkable people and hopefully make a contribution, but also learn a huge amount. And I think it's all about having an open mind and trying to be interested in different things.
Are there many surgeons in the House of Lords?
Yes, there's Lord Ribeiro, former president of the Royal College of Surgeons, Lord McColl, former professor of surgery at Guy's, and Lord Darcy, who's currently professor of surgery at Imperial.
So what do you surgeons bring to the House that is so special and different to the general politics?
I think that's a question really for other members of the House. What I would say, though, is that we are all privileged, each of us as surgeons, because we are provided with a remarkable training, which brings a self-discipline and a stamina and a relentless focus on the interests of our patients. And those are all pretty useful qualities when it comes to broader contribution.
Fantastic. Now, tell us, please, if you would, the top 3 tips for aspiring surgeons and young clinical academics who want to follow in your footsteps.
Well, I would say that you've got to be interested and really fascinated by questions in medicine, in clinical practice, in science. It's really good to have an inquiring mind and want to pursue ideas and interests and research things. Second, I do think we all have to remember, aspiring or established, that the point about practicing medicine is our patients. And therefore, first and foremost, our attention and our commitment must be to their welfare, their safety, their good clinical outcomes. But thirdly, you must never forget that we work in teams and we work with colleagues. And therefore, it's hugely important to show respect to others and always go out of one's way to be collaborative and supportive of those with whom we work.
Ajay, thank you so much for your time. I know you are a very busy man, and it is so lovely to be able to speak to you and inspire other young academic surgeons wanting to do what you have done. Congratulations again on the KBE.
Thank you so much. It's very, very nice to talk to you, and I look forward to catching up soon.
Thank you.